Okay, so I've been a little behind on my blogs. Things have been crazy busy at the office, but here we go. So today we're continuing our short blog series on food as medicine with another study to show the powerful effects a diet can have on your health. So a recent study showed a low-carbohydrate, whole foods diet, low in inflammatory foods, significantly decreases thyroid antibodies, the marker for autoimmune thyroid disease, or Hashimoto's thyroiditis. Now let me make a side note and be clear about something. Even though Hashimoto's thyroiditis is often called an autoimmune thyroid disease, it is not a disease of the thyroid. It is an immune disease that affects the thyroid. There's a difference. So Hashimoto's occurs when the immune system attacks and destroys the thyroid. It is the cause of about 90% of hypothyroid cases. This study is further evidence you can profoundly influence autoimmune Hashimoto's through diet and lifestyle interventions. In the 3-week study, almost 200 people with Hashimoto's were divided into 2 groups. One group followed the low-carbohydrate study diet, while the other followed a standard low-calorie diet. The results were significant. Levels of several different thyroid antibodies that serve as markers for Hashimoto's dropped between 40 and almost 60%. This group also lost a little weight, but really not the important part here, but a nice added side benefit. Meanwhile, the group that followed a low-calorie diet saw antibody levels go up between 9 and 30%. So what did the study group eat to tame Hashimoto's? The study designers chose a curious route for their research in having subjects follow both a low-carbohydrate anti-inflammatory diet as well as a diet low in goitrogens. Goitrogens are compounds that lower thyroid function and are found in raw cruciferous vegetables, broccoli, cauliflower, cabbage, etc., soy, and other foods. So for my patients and others that only eat broccoli or cauliflower because they don't like other veggies, cut it out. You got to get other stuff. Before people understood the mechanisms of autoimmune Hashimoto's, it used to be the rule of thumb to avoid goitrogenic foods. However, through the evolution of functional medicine, we have learned most people with Hashimoto's can safely eat normal amounts of cruciferous vegetables. In fact, they contain many beneficial nutrients as well as fiber. So people with unresolved small intestinal bacterial overgrowth, or more commonly known as SIBO, or genetic difficulty metabolizing sulfur, may not do well with these vegetables. So we don't really know how subjects would have fared in this study had they included these vegetables, just because they weren't included. Soy, on the other hand, has been shown to lower thyroid hormone levels in studies and is best avoided by those with Hashimoto's. So here's the diet in the study that subjects ate that lowered their thyroid antibodies, thyroglobulin and TPOs. Number 1, low carbohydrate diet that was 12 to 15% carbohydrates, 50 to 60% protein, and 25 to 30% fats. Most people eat a diet that is at least 50% carbohydrates. Way too many. I often hear the argument, but don't I need to eat carbs? That's what the food pyramid guide says, right? Please. Number 2, lots of different vegetables. Research shows a diet high in veggies improves immune function through its impact on beneficial gut bacteria. The key word here is different vegetables. You can't eat the same thing day in and day out and expect to be healthy. Number 3, lean meats and fish. Number 4, no goitrogens. Cruciferous vegetables, which if not eaten to excess, improve beneficial gut bacteria. Canola, watercress, arugula, radish, horseradish, spinach, millet, tapioca, and nitrite veggies. Not nitrites, nitrates. Number 5, eggs, legumes, dairy products, bread, pasta, fruit, and rice. Remember, this is what was done in the study. This is not necessarily what I would recommend to each person. Each person is different, so we have to change it accordingly. In functional medicine, we know gluten and dairy exacerbate autoimmune Hashimoto's for the most part. Eggs, legumes, and grains are inflammatory for many people as well. People with poor blood sugar stability may need to limit their fruit intake as well. Sometimes in the range of like 1 to 2, or for some people, no fruits. This study backs up and is very similar to my previous post on the AIP diet. Check out that post too. So there you have it, more evidence that food is medicine. I'm Dr. Craig Mortensen. Be healthy, be happy.